Good morning. Do you want to stretch your hands up? Wake you up. That's Rachel's job, but I'm trying to do it for her. I know I'm standing between the lucky draw and you, but I'm going to share a story of a patient, and a very important story. This patient was managed by me, and I hope I convey the challenges or the difficulties this patient faced while she was suffering from bowel incontinence. Okay. Now, I work in Kutekpot Hospital. I'm sure some of you might have visited it. And I'm also a volunteer for Society for Continence Singapore. And I hope we will get many more volunteers from this group as well. Now, this story starts, she's a 48-year-old lady with 3 children aged 18, 16, and 14. And she had forceps delivery of the first child with an episiotomy. Now, these are technical words, but I'm sure you understand forceps is an instrument which helps the baby to come out, and episiotomy, sometimes the gynecologist or obstetrician has to give a cut to help the baby come out. Now, something strange happened to this patient after the birth of the 3rd child. She noticed 2 important things. Number 1, it was difficult to wipe herself clean after passing motion. And number 2, she would occasionally soil her underwear. Now, hoping that all of us hope that everything will be okay, she did not mention it to anyone and continued with her usual work and activities. But what happened, it gradually worsened. She could not control her motion, she had to rush to the toilet, and she was always worried about the smell of the feces, right? Now, she felt very helpless but did not tell anyone. And this went on for 4 long years, right? And there was an obvious impact on her personality. Now, the impact on the personality can be multiple, but before that, we need to understand what is bowel incontinence. Now, bowel incontinence is also called as fecal incontinence, and it is just the inability. That means you are not able to control either the gas, liquid, or stools. That means even like passing gas without your control is a part of bowel incontinence. And the typical symptoms when we look out for patient with bowel incontinence include that patient cannot control or leaks solid, liquid, or even gas. They're unable to reach to the toilet in time. That means if you get an urge to pass motion, you just cannot reach the toilet in time. And also there is occasional or sometimes persistent soiling of the underwear. That means they always feel wet. They are worried about the smell. Now, there are many causes for bowel incontinence, but the major ones are listed here. And the most important ones are muscle or nerve damage, and it's often from the childbirth. That's why bowel incontinence is more common in females. And in fact, continence disorders are more common and you can see the picture here, the most common cause. This is the price our mothers pay when they give birth to the children. Because the pelvis or the perineum is stretched, sometimes the surgeon may have to use an instrument to deliver the baby, and there is a damage to the muscles around the backside also, what we in medical terms call the anus. But most of the ladies are young when they give birth to children, so they don't experience much dysfunction in the bowels at that age. But as we age, in 40s or 50s, the muscles start becoming weaker and weaker, and this effect is apparent. That means patients start getting the symptoms of bowel incontinence. There are other problems like age-related weakening, chronic diseases like diabetes, dementia. If patients have prolapse. Prolapse means when the rectum or the backside comes out, or if there are very large piles and patient continuously strains, it can also lead to damage to the anal muscles. Now, Do you all know, should we care about bowel incontinence? I'm happy you are all here because you care about bowel incontinence, right? We do need to, and there are two main reasons for that. The first reason is that bowel incontinence is actually not uncommon. If you look at this simple mathematics, right, 5% of people in Singapore are actually having bowel incontinence. With that simple maths, there are about 300,000 patients. That's a big number for a small country, right? 300,000 patients with bowel incontinence, and most of us actually do not know about them. And the second reason is that most patients actually suffer in silence, right? Because there are no words. It's kind of a stigma to talk about it, right? Many patients or even their loved ones do not talk about it because they fear how this person will react to it and how, I'm going to talk about it. Now, we have seen that neither the patients or even the doctors feel comfortable when they want to talk about bowel incontinence. In fact, it gets lost in translation, which means many patients, they will tell you, oh, I have diarrhea, I have loose stools. But they will not say that I cannot control my bowels because they fear that, it won't be taken well or nice. So there is a saying that patients don't tell and even doctors don't ask about it. That's why it is an unrecognized problem in many countries, including Singapore. In fact, more than 70% of patients do not talk about it. Many years back when I came back from fellowship, we did a simple study in my clinic. The patients are waiting outside the clinic. We gave them forms to fill up. Just 3 questions. Do you have any problem in control of motion? Have you seen anyone or have you spoken to anyone about it? We got that nearly 40% of the patients who walked into that clinic had some problem with bowel incontinence. But when you talk in person, they don't want to talk about it. That's why these patients suffer in silence, because there is a stigma or some difficulty in communication about this. And this is mainly, there are myths about bowel incontinence. There are multiple myths. Hopefully, I will talk about some of them. Now, we come back to our patient. She, after many years, spoke to a friend, about the difficulty in controlling the bowel. And the friend also probably didn't know much about it. She was told by the friend, okay, it's a normal part of aging. You need to live with it. It won't affect much. Do you all think bowel incontinence does not affect a patient? Does it affect? Does it not affect? Good. Yes, it does affect. It has a lot of impact on the patient's whole life. There's emotional disturbance, there's lifestyle restrictions, simple pleasures like going to watch a movie or sitting here or going to watch swim. These people are very scared and they fear that there will be smell, people won't like them, they don't go out. In fact, they get isolated, they just stay at and don't talk about it. And there is even loss of independence, loss of job and self-worth, So it's a very difficult and unseen battle which they are fighting. The difference between the seen and the unseen battle is if it is our loved one has some problem, like a usual medical problem, we can go and help the person. But if the patient is fighting inside and nobody is noticing about it, it becomes an unseen battle. We can't help because we don't know about that unseen battle the patient is going through. But she was a fortunate patient, The husband and the family noticed the change. They noticed the change in her personality, and they were very supportive. And the first thing we all do, either go to a polyclinic or to a GP, and they went to seek help from the GP. Now this patient went to see the GP. This GP realized the problem of bowel incontinence, and he gave this patient a stool diary. Now this is a very simple diary which you all can maintain at home if you or your loved ones have any issue either with the bowel or urinary incontinence. It's just like you plot time on one side and the date on one side and just document whether there was any leakage or any problem in controlling the motion or the urine. Now, when you bring it to the doctor, it gives us an idea how severe or bad is the problem. If you continuously leak multiple times a day, then we know it's a severe problem. We can treat it more expeditiously. We can do some diagnostic tests. But if it's a minor problem, it can be treated most of the times by physiotherapy or simple lifestyle changes. And this GP also referred to this patient to a specialist. Now, fortunately, this specialist had a background in training about bowel incontinence. So this patient had a very positive experience. And like any other disease, a specialist basically wants to confirm three things. First, we want to confirm the diagnosis and what is the possible cause, because then only we can treat the patient, right? The second thing which we want to know is how bad or how severe is this disorder, because then we want to do different things for the patient and then discuss the management options. It's not that you come to the surgeon and immediately there will be a surgery. No, there's a process of assessment, of severity, confirmation of the diagnosis. We start with more simpler things first and then on go to the more complex things. Now, this is a simple flow. What a specialist does when a patient with bowel incontinence comes to us, we assess the severity. There are some simple tests, like an ultrasound. It's just putting like a finger in the backside, and we can check whether the muscles are good or not, whether there is any problem with the nerves, how good are your pressures. So there are very simple tests to check the severity of the bowel incontinence. And then we move on to the conservative. We usually refer to our physios. You heard what they do, what exercises, and we also start with some simple medications, which are usually like antidiarrheal medications, and majority of the patient might get some relief with that. And then we do consider some surgical options if there is a need. And also, because as you know that this disease is not like a simple medical disease, it can affect the whole quality or whole life of a patient. We do have patient support groups to help these patients. Now, this is what as specialists we use. It is a simple chart. We assess the severity of bowel incontinence by this. You can take a picture and you just have to score here. 0 means perfect control and 20 means worst control, and in between is 1 to 6, mild, moderate, and severe. So this is one of the standardized or what we call a validated scoring system for bowel incontinence, which can be used by anyone to see whether you have this problem and how bad is the problem. Right? Now, you have had a full lecture on physiotherapy. It's just like, we want to build strength, we do go to the gym, exercise, but if we go do it under a trainer, the results will be better and more consistent. So these are commonly called Kegel exercises. They help to, strengthen our pelvic floor, and hopefully they help in reducing the symptoms of incontinence. Now, this patient went to see a physiotherapist. She also went to see a dietitian, because we know that diet can play a role in our bowel and how our bowel habits can be. And she completed a 3-month therapy. Physiotherapy can take long time, and we have to be very patient to get the results. It's just like we want to be like, muscular. We go to the gym, we can't build it overnight. It takes months and months and sometimes years. And there was some improvement in the bowel control. But she was still bothered, The panties used to get occasionally. And this time the surgeon, after doing the test, which I told you, ultrasound and manometry, the pressure test, the surgeon offered her what we call an anal sphincter repair. Now, anal sphincter repair is as simple. If you look at this picture, this is our normal sphincters. We have 2 rings of muscles around our backside. One is the internal ring and the other is the external ring. They help us to control the motion, right? Now, this is what happens in bowel incontinence, that this ring is broken, right? You can see the ring is broken, and what as surgeons we try to do, we try to bring the two muscles together to complete the ring again, so that you can use the muscle again to control your motion. Now, it's a simple operation, provided the muscle is also of good quality. That's why it's overall you have to be strong, you have to have a good diet, so that your muscles are strong, and even if we operate on it, they can work well. Now, in spite of being a simple operation, all right. So the good part about this operation is that it's a simple operation, and there can be good control. But the bad part about this operation, this control does not last for long. Usually it has been seen that for about 4 to 5 years, the control can be good. And then because as we age, overall muscles become weak, then this control may not be so good after a few years. So her overall quality of life improved, but after 5 years, she started to get symptoms of bowel incontinence again. And this time she became very anxious. It's obviously you have been suffering from a disorder for the last 10 years. She became very anxious. And this can happen to the patients with incontinence. You become anxious, you become agitated, you start withdrawing, and there may be a need to see a psychologist or you get some mental support health also. And she went back to see the colorectal specialist, and then the next in order was discussed, which I think Dr. Yao spoke to you, was neuromodulation. Neuromodulation means we want to stimulate, that means stimulate the muscles around the backside with some external electrical impulses. We want to stimulate so that if we cannot exercise, something else can exercise our muscles so that they can become stronger again and control the bowels. You have seen this, it is called PTNS. It is the simpler form of neuromodulation. It is available in most public hospitals, and where you have seen this picture, we put up this needle near the ankle, and the nerve electrical impulses go along the nerve and stimulate our backside muscles, hoping that they can improve the control. Now, this patient went through, again it takes time, but her battle with bowel incontinence continued. It's not an easy battle, it's a long battle, unseen battle. But the turning point came when she joined a support group. Now, support group is patients who have similar issues. The good part about a support group is that you can discuss issues, simple issues like sexual life, planning with precision, coping with stress, planning activities, outdoor activities, planning for a journey, because you can share the same experiences. Now, it turned out to be a positive and a very fulfilling experience for us, and she became a regular, in fact, she's one of the supporters of this group at this point of time. So I hope I have shared with all of you the journey, especially this unseen journey, and the battle that a patient with bowel or even urinary incontinence goes through. And with this, we must keep in mind that there are multiple myths about bowel incontinence, which are that it is a normal part of aging. So is it a truth? Is it a fact or it's not a fact? Anyone? Is it true or not? No, it's not true. It's not a normal part of aging. Bowel incontinence, many people still think that it's not a medical issue. Is it a medical issue or not a medical issue? It is a medical issue. Many patients say, I'm not incontinent, I just have accidents. I just have diarrhea. No, diarrhea is different. Bowel leakage means you cannot control your motion. There's nothing to do about it. I can't do anything. Nobody can do anything about it. It is true or not true? Not true. It's just a minor inconvenience. Is it true or not true? Not true. It's a major inconvenience. It can have a major impact on the quality of a person. Now, if you look at it, the facts are that bowel incontinence is abnormal at any age, probably maybe the infants, but anything beyond 1 year of age, any leakage of stools, gas or liquid is abnormal. It is a medical issue. It should be treated like any other disease, like high blood pressure, diabetes, or any other disease. Any involuntary loss of gas, liquid, or solid is incontinence. And as I have shown you through the journey of this patient, control and cure is possible in many patients. So let's all think again. Thank you for coming. I hope you will share this message with many more among your friends, your family, and we will continue to do this good work. Thank you very much.